There's a waiting room most of us never think about. Not the kind with magazines and soft elevator music. I'm talking about the one in your own home, the bathroom. For some, it's a reading nook. For others, a scrolling station. We sit, we linger, forgetting this space was never meant for long visits. Here's the strange part. The longer you sit, the more pressure builds in a place you often don't think about. The anal canal. Inside are tiny cushions, little bean bags of blood. They're supposed to be there. They keep things sealed when you cough or laugh. But when you strain or sit too long, those cushions sag and swell. And one day you notice a streak of blood on the paper or a lump that makes sitting miserable. That's when people panic. They Google blood and stool, and the algorithms often offer cancer, colitis, catastrophe. Rarely does it whisper the far more likely truth, hemorrhoids. And here's the misunderstanding. Hemorrhoids aren't some alien growth. They're normal anatomy. Everyone has them. They only become a problem when they enlarge, and they remind you of their existence in the most inconvenient way possible. So today we're going to do what few people dare. Talk about your butt. We'll break down the hidden anatomy, why some hemorrhoids hurt and others don't, what's myth and what's real, and why a quick doctor's visit can turn a source of embarrassment into something surprisingly manageable. Because hemorrhoids aren't about shame. They're about how something so ordinary can become quite literally a pain in the butt.
Views and opinions expressed in this podcast are those of the host and guests, do not reflect official policies or positions of any affiliated institutions or organizations. Podcasts are informational, educational, and entertainment purposes only, and it is not intended to provide medical advice, diagnosis, or treatment. Listeners should consult their own healthcare professionals for any medical concerns. I'm Brody Nolan. I'm an emergency doctor.
I'm Josh Levitz, internal medicine.
And I'm James Jung, a general surgeon. This is not another medical podcast.
Perfect. James drinking out of the blue cup.
Oh yeah, it's the way to do it. Not sure what that means.
I don't know what we're talking. I have no clue. Weirdest introduction ever.
Yeah, not sure how
Yeah.
we should pick this up.
Yeah, I know. Right? We're starting this off on a real low point here.
Yeah. I mean, the
Let's
only
start
way
boy.
is up.
That's it. That was my plan all
That's
along.
right. You gotta start low, and hopefully there'll be some incremental changes along the way.
Yeah. And there's probably a tie-in to what we're going to talk about today with that statement.
Aha. There you go.
Nice,
There you
nice.
go. Yeah,
Early
a little bit of
segue. I
foreshadowing.
appreciate that. Yeah.
Yeah, it's too early for that.
What's new, guys?
Yeah, so we have a relatively bigger backyard than my condo in Toronto back in the days. And you guys know me. I'm not like a handy person. I don't know how to do landscaping at all, right? So I've kind of
What did you do?
I've kind of like neglected, like getting rid of the weeds. Like, I try to like mow the lawns and, fertilize and water and all this stuff. But there are all these naturalized areas where, these are like wooden mulches, right? And then it's been just overtaken by all these weeds, right? And, and of course they look kind of messy. So I've been trying to like pick out like a little bit of weeds here and there. There are these neighbors' kids, two of them, probably around like maybe 15, 13, and they're really like savvy and they're like great business people and they just walk around and they actually like do quite a bit of landscaping around the block. And like they came up to me like while I was like, picking out these weeds and they're like, hey, Dr. Jung. And whenever you hear that, whenever they call you Dr. Jung, they know exactly what they're doing. They're very smart, right?
Yeah.
And they're like, like we could do that for you, over a few weekends. I was like, okay, like, I totally,
You're like,
yeah, got sold, right? So,
yeah, you're like, I am Dr. John.
yeah,
I would love
yeah,
you to do
yeah.
that.
So, yeah, they've, we ordered like 15 cubic yards of mulch, which is a lot. I did
Yeah.
not realize how much that is. And, these kids have done really good job. And I was like pretty impressed with their work ethic. And they're very honest with like how many hours they're working. Like, so impressed, like very professional. I was like,
Awesome.
wow, this generation, I'm not worried about them.
Awesome. Well, just wait for the identity theft, and then we'll talk. Yeah.
That's right. No, but I was so impressed. So that's what we've been doing over multiple weekends now.
Nice.
We've been doing.
Yeah,
I love that you
as
said we've
in
been doing
I
it.
hired these like little kids to do.
James is sitting on the
Yard
porch
work.
just watching and be like, "Yep,
Yeah,
clocking you by the hour."
That's
Let's
right.
see. I went to my first kids concert. Like not like my
Oh, yeah,
kids
I saw
performing in the
that
conference, but I
on-
mean like actually like
gram.
going to a concert for So big
What was
shout
it?
out to Danny Go. If anyone has kids, he's like a YouTube singer.
Danny
But
Go.
like he got together after having
Looking him
kids
up
about
now.
making up songs and just makes up songs with his like high school friends and
Yeah.
has gotten super popular on YouTube enough that he's like touring North America right now.
Wow.
So he did a stop in Toronto and
He's
it was honestly
I just
like top 10 concerts of my life.
Really?
I've maybe only been to 11, but it honestly was like, it was so much fun. It was crazy energy. It was like a rave the whole time. The girls were going crazy. There were glow sticks. Everyone was like having a good time.
this
wow.
is right up your alley.
It was sweet. Honestly, like,
We
yeah.
I'm just looking up Danny Go, and the pictures are very bright. There's lots of glow
Yeah.
sticks, and he has such songs as "Glow in the Dark Shapes," "Escape from Tiger Island," "In the Mood for Food,"
hmm
and many more.
Yeah. Yeah. It
he,
was a
I'm in.
he
party.
knows his
It was a
market,
party.
I know.
He's like these kids on the neighborhood.
Like the show was so
knows.
good, I like highly debated buying a T-shirt merch on the way out.
Oh,
Like,
yeah.
nah.
Why wouldn't you?
But it was
These-
oh man,
these-
it was so good. It was so good. I thought
I'm
it was
always
gonna, like,
I'm always interested in.
yeah.
I'm interested in the backstory of all these, like these ones and the Wiggles and all these. Like, how do you get into, like, are these actors who do it? Are they singers? Or they're just like, this is a great market.
Yeah.
I'm getting in on
Oh, yeah.
this.
I know, totally. And that's it. There's some that are like kind of sketchy. I don't want to maybe like name some. Danny Go's not one of them, but some
Yeah.
like their backgrounds are a little more noted.
Yeah.
You
It
know,
was funny. There's a Wiggles documentary, and I watched it just to see the dark side of the Wiggles. But they are all like perfect human beings. There was nothing dark. It is like they're all happy. Everything went well. I was like, well, fine. I guess it does happen.
and I was really hoping there'd be a dark end to the only for like entertainment. I mean, they're wonderful people.
Yeah.
I wish Emma would come
This
back.
is
Like,
this
they're-
is what I wish upon children of the.
Ask me about like current
Um,
music, and I got nothing. But all right, let's do Wiggles and Danny Go. We got.
Sure.
Well,
Oh man,
these are very
Yeah,
smart,
cool.
opportunistic, entrepreneurs. Doing their best.
Entrepreneurs.
Good for them.
That's it.
Just like us. Just like
like
us, guys.
us.
Just like
Just
us.
like us.
Yeah.
And this podcast.
We have a lot less green screen. That's what we need. We need like, I don't need a dinosaur head. I need like a mobile full dinosaur animated background with like a volcano.
That'd be
exploding.
awesome.
That's how we.
Yeah.
That's how we do
Also,
it, guys.
Most people just listen to this. They don't watch us.
Yeah,
So
for good reason.
I don't know if you want to go there.
That is
Actually, I
very
think most
much
people
true.
don't listen to us either, Josh. I think it's
Very, very true. Appropriate. Yep. Very true.
Well, all right.
So what are we getting into today? So James, you want to take us into the wild world of hemorrhoids?
Yeah, I mean, I would love to.
no segue for that. Right
No,
into it.
we're-
just straight
I don't
in.
think I don't think hemorrhoids need a segue.
Yeah, yeah.
It's like this is one of those things that everybody in the world has heard of hemorrhoids.
Yeah.
Like we'll bring up other diagnoses. People are like, what is
Yeah.
this? Hemorrhoids. Everyone's like, oh yeah, I know those.
Yeah, hemorrhage is very frequent. A lot of people experience it, especially as they get older. It's often misdiagnosed or undiagnosed. People don't like to show their butts, so often they're undiagnosed, and people suffer in silence. I think there's no glamour in treatment of these or examination of these or suffering from these, but I think it's such an important entity that affects a lot of people. So if you are a listener who thinks that they have hemorrhoids but unsure or don't want to get examined by doctors, like I think this is episode for you. There's a lot to unpack here, a lot of misconception, a lot of confusing anatomy. So that's why I picked this topic. We're gonna have a little bit of fun, I think. Whenever we talk about there are few topics that kind of lends itself for real fun discussion, and I think this is probably one of them. But there's nothing funny about having hemorrhoids.
So
Happy hemorrhoids.
I like that. And guys, like, I don't want to call us heroes, but we're talking about the things that people don't want to talk about. Yeah. So, there's big words to put to us here.
I mean,
James, I do appreciate the themes of your episode, though. Farts, butts, hemorrhoids. It's good. It's good.
No, it's body humor. Now, Brody, we're going to try something. James, you can't answer. Just to prove to listeners that doctors don't know much outside of their own little world. Brody, what do you know about hemorrhoids?
I certainly know they are a common cause for coming to the emergency department. Are you trying to quiz my anatomy for the reason why they're there, how they're there, those things? Because I will happily defer that to our surgeon expert on the line.
I am literally trying to show that I know nothing about hemorrhoids except they bleed.
Yeah.
And if they bleed a lot, I sometimes see them and send them to someone else. I know nothing about them, so I'm like super excited about this.
Yeah, me too.
Yeah.
I also wonder if the at-home diagnosis of hemorrhoids has improved since the camera phone. Just saying, pretty easy sometimes to take a quick pic, see what's going on down there. Is there something bleeding? I'm not too sure. It's a bit hard to see. But I feel like before that, your options were either you like old school foam it or old school take a picture, send it off to get processed, pick it up 3 to 5 days later.
You mean like the actual films?
Or like
in the dark room?
The two mirrors, see if you can kind of get things aligned. Like, I don't know. Yeah.
I mean,
to get back to your recent, your point, James, about the being undiagnosed.
It's certainly hard to see it yourself. We have certain range of motion in our spine, but not to that degree for most of us, at least, unless you work for Cirque du Soleil. So it's certainly hard to see. A lot of it is kind of the symptoms. So sometimes the symptoms could be vague. Sometimes it could be concerning when there's blood involved in the toilet. So I think we should just really dive into it. And what better way to start than understanding the anal canal anatomy? So I think it's important to kind of understand. And I don't think there are many of us who think a lot about anal canal, but certainly during
that's an understatement.
Many of us, there are many of us that think about this all the time.
When you go through general surgery, training, this is certainly a very important anatomy that we learn about. And
would you call this your butt and butter?
No.
The one?
No. So
you may have to explain that joke for some people, Brody.
So the anal canal is the very. I'm just gonna move on. It's the very end of your GI tract, and I think the easiest way we could think about this is what's palpable of the GI tract with your finger. I'm not saying that you should put your finger in to palpate the relevant anatomy, but if you are thinking, if you visualize the extent of what's palpable is kind of the anal canal from the anal verge. It has, in about 2 centimeters in, it has something called a dentate line, which is kind of the division from external closer to the skin, what you see, and internal hemorrhoids. And the internal hemorrhoids, first of all, the hemorrhoids or hemorrhoidal plexus are not abnormal anatomy to begin with, but we all have these hemorrhoidal tissues in the anal canal. But as they get stressed, there's a repeated trauma, or if they get inflamed, or if the vasculatures get engorged, they get bigger than normal, and that's when you start to notice them. And in the internal hemorrhoids, there are actually 3 pockets of the cushions. So these are kind of the cushions that we all have. There are 3 of them. There's one on the left, and then there are 2 on the right. And then these are kind of the cushions that exist, and they really help with kind of the control of continence. So, some of those liquid bowel movements, and you're laughing hard, controlling that and holding that in is kind of, in addition to the sphincter muscles, these really help with this.
They're kind of like the unsung heroes of the day. They really kind of keep everything in.
Mm-hmm.
Yeah. Otherwise, it'd be socially awkward.
Yeah.
Well, I guess not if everyone was doing it.
Yeah. If it's a norm, right? Like that,
Right.
I guess, that would be true. And then below that dentate line is the external hemorrhoid, where the external hemorrhoids could abnormally grow. So external hemorrhoids, there isn't really hemorrhoidal tissues there, but there's an engorgement of the tissue below that dentate line. It's not discrete like the internal hemorrhoids, where they're kind of the 3 cushions. These external hemorrhoids could form kind of in anywhere. But it's just an engorgement of the tissue there, and those are the external hemorrhoids. The dentate line is important because the innervation is different from internal and external. So external, on the skin side.
You just explain.
Sure. It's
the
nerve. So we're talking about,
Supply.
what are the nerves that help you feel. So on the external side, which is close to your skin, the innervations or nerves are more prone to feeling pain, whereas internally, there's less innervation of the sensory or the pain. So because of that, the external hemorrhoids will be painful, whereas internal hemorrhoids often aren't painful. So when we do an examination, and when we, let's say, pinch, and we're going to talk about some treatments for internal hemorrhoids, or band, squeeze the hemorrhoidal tissues above the level of dentate line, patients don't often feel anything. But if it's, you're pinching or stretching or pointing at the external hemorrhoids below the dentate line, it's painful. So external hemorrhoids are the painful ones, internal hemorrhoids, painless.
Question for
Yes.
you. Maybe we're in this, maybe we didn't. So are hemorrhoids the pathologic name for when these tissues become inflamed and things you'll get into? Or do we have literally hemorrhoidal tissue? Is that what we call it?
Yeah.
When it's healthy and everything?
Yeah. So I think hemorrhoids are now accepted as kind of the pathologic, like internal hemorrhoids, external hemorrhoids, but the hemorrhoidal plexus or hemorrhoidal tissues is actually a normal name for normal anatomy as well.
See, I'm learning stuff. I love this podcast.
Yeah, I think the external and internal hemorrhoids, like, would be, the internal hemorrhoids being painless, external hemorrhoids being painful, I think is really important to you. I mean, I think once you rip that Band-Aid off of meeting someone else who's had hemorrhoids, or then talking about people with hemorrhoids, then often there's a little bit of like, oh, mine are painful, mine are painless. Like, there's a little bit of that sometimes where people are worried about whether it is hemorrhoids or is not hemorrhoids, if it's painful or not painful. So I think it's kind of helpful to know, because if you're talking about your hemorrhoids as a whole, like, your experience might be very different than someone who, if you had internal hemorrhoids, there's blood in the toilet, your experience might be very different than someone who had external hemorrhoids, who, like, wow, this is like the most painful thing, and I couldn't take a poop for forever because it hurt too much. Like, I think it's good for just to know that your symptoms can vary quite a bit between those two, depending on whether they have that nerve supply that you can feel it or not.
Right. Yeah, I think that's very important, because I think this is kind of theme of a lot of what we talk about. As patients, or average listeners, we experience things. Those are the symptoms, right? And not all symptoms are specific to a certain pathologic process. Like pain in the butt can be from, or pain in the anus. Anus could come from a variety of things, right? So I think it's very important to get examined. And same thing with like the bulge in the anus, which, can be external and internal hemorrhoids. If the internal hemorrhoids get bigger, they prolapse, and then you could experience bulge in the anus. That could be both internal or external. So very important to be examined by experts.
Want to say
before Brody says anything, I'm pretty sure he has a pain in the butt joke right here. I'm going to call him on it.
no. I was just gonna say I'm so proud of us because there's such an easy layup for making pain in the butt joke, and none of us went for it. I'm really proud of us. That's all I was gonna say. But clearly, you and I were like,
it was too
"Don't
easy.
say it."
It was just too easy.
I'm having
so-
fun.
James, you talked about hemorrhoids being the result of repeated trauma, inflammation. Like, what does trauma look like for the butt? Like, I know that maybe maybe not obvious, but like, what? Yeah,
That's an
what do you mean by
appropriate
that?
I think
question.
yeah. So the most often trauma, like most frequent form of trauma in the anal canal would be if you're having really hard stools. So if you're constipated, you don't consume enough fiber or you don't consume enough water, and the stools are like rabbit stools, which, by the way, I don't know if you've seen rabbit stools. They look like Cocoa Puffs. Now you can't eat
do.
that.
I've seen Cocoa Puffs. Yeah.
So, like as you pass those hard stools, it could create mucosal traumas along the way. So that's a form of trauma. Or if you're straining, putting pressure, like if you're spending a lot of time on the toilet and straining, that pressure could be a form of trauma with the hard stool. But it could also be, from penetrating trauma, like anal intercourse, or instrumentations, or even being examined for with the anoscope. Although we do it very gently with like lots of lubricant, but it can be a form of trauma.
And I think it's interesting as we talk about this because the things that cause it are probably the things that help prevent it too. If you do things the right way, you'll probably talk about it later, but keeping the stool soft and regular bowel movements and all that. So it's one of those kind of easy connections here.
Very important, and I'm sure we're going to have a bulk of our conversation around those. So
Oh, I see what you did there. Bulk,
Hey-o,
fiber,
bulk.
nice.
Love it. Love it.
James,
And
I've
that
heard,
AI did not give you that joke.
James, I've heard before of different like grading or severity of hemorrhoids. Can you maybe kind of break that down a little bit for what that might kind of look like? So
So the grading that we often use is for internal hemorrhoids. So there are 4 grades. So it goes from 1 to 4, 1 being the mildest form and 4 being the most severe form. So grade 1 internal hemorrhoid is hemorrhoidal tissue that is enlarged and that could bleed. So if there's a blood in the toilet, and if that hemorrhoidal tissue or it gets engorged and it's prolapsed into the lumen, like within the anal canal, that'll be grade 1. Grade 2 is that tissue prolapses out of it. So kind of like, if you're pooping, like it just prolapses out of it, but it spontaneously goes back in. Grade 3 is that it comes out and you need to manually push it in. So manually meaning like with finger or, tissue, or to push it back in. Grade 4 is the one that's prolapsed and it doesn't go back in. So it's just the severity of how big the tissue is. And grade 1, even if it's not enlarged, if it bleeds, then, it's still considered hemorrhoidal or internal hemorrhoids.
Just kind of going back to what you started talking about, people need to get this looked at. I'm guessing there are people who are walking around with like grade 3 prolapsed hemorrhoids that are just pushing them back in and not getting checked out, not getting treated.
Yeah.
So I'm guessing it's pretty common.
I think it's very common. I've done some kind of research into like how frequent this is. I think the studies are actually very poorly done, but some of the survey studies from 1980s and 90s demonstrate that in the US, the prevalence of hemorrhoids is about 4 to 5%. But when they do a colonoscopy, and then we always perform digital rectal examination, and we also do a retroflexion view of the hemorrhoidal tissue to look at the hemorrhoidal tissues. And when we see that, the actual prevalence of hemorrhoids is more about like 20 to 30%. So
that's huge.
there's a big discrepancy between, what patients would report versus, what is actually happening.
Mm-hmm.
Okay. So that's the internal the internal hemorrhoid, not internal medicine, the internal hemorrhoid world. What do we need to know about the external hemorrhoid world?
Yeah, maybe Brody, like I'm sure you see some external hemorrhoids. So what do you have kind of, tell me about your experience other than calling me middle of the night to take care of this.
Or listen, or Brody, if you have hemorrhoids yourself, talk about your personal experience.
I'm going to choose to not share about my personal hemorrhoid journey, or verify or deny whether I have ever had personal hemorrhoids. Not because I'm embarrassed. I'm just choosing to make that statement now. But no, so external hemorrhoids are probably the most common type of hemorrhoids I see in the emerge. And to get back to the reason, it's because they are a giant pain in the ass. They are so painful. And so, there is often people have more pain before they may have bleeding, sometimes with this. And so, what I see when patients are coming with external hemorrhoids, there are these little kind of out pocketings, kind of, bulging things of tissue, usually right again within kind of that your anus itself, the anal verge, and they're extremely tender. Like even sometimes just like kind of spreading the butt cheeks, if you will, to try to get a view of it can cause enough kind of that's quite painful. And that's kind of usually what we're seeing then. I'd say most of them are maybe the size of like a marble or so. Like they don't have to be quite big, but they're extremely painful. When you're coming into the emergency department, the one thing that we're thinking is there something we can do about this? And maybe this is kind of advancing a little bit, James, what you're going to talk about afterwards. But for us is trying to figure out, is this like a fresh external hemorrhoid, or is it a quote unquote thrombosed external hemorrhoid? So is it firm now? The blood inside is clotted, and that allows us to do treatments like lysing it and cutting it open, which really alleviates kind of some of that pain. But that's usually what I see from an external hemorrhoid perspective. Extremely painful and uncomfortable, and really these small, like marble grape-like sizes.
Yeah. And Brody, before we kind of go anymore, I think it's really important to talk about how people present to you. Like why then? What brings them into the emerge and says, okay, I've been dealing with this for 6 months and today's the day the pain got too bad, or I was fine yesterday, I'm not today. What does the story sound like?
It's usually a fairly acute thing. Like it might be over a day or two. It really progresses to the point now that they're having so much pain that they're actually trying to not have a bowel movement. Because again, you can imagine if you're, when you're having a bowel movement, again, the anus opens up to allow all your poop to come out. But that itself is so painful that sometimes they'll try to really avoid trying to have having a bowel movement because of how painful it is. So that's usually it. I'd say it's more pain that brings them into the big ones, or sometimes it's, hey, I went to the bathroom and there was some blood in the toilet. There was blood when I wiped. Yeah. This is new. And even that is quite scary for a lot of people. And, this is going back to earlier episodes about like bleeding and blood, and it's hard to know how much blood you're actually losing. That's especially true when it goes right into the toilet. So you can have like a small amount of blood, but once it hits the water in your toilet, your whole toilet bowl is red. And so if you're the kind of person that turns around and looks at your poop before you flush, that could be really scary.
Which I recommend doing.
Yeah. Well, so that's fascinating. If you do a poll, not everyone does. I'm one of those that have a look just to kind of see, what's the color?
Especially since having kids.
Yeah. Oh yeah, that's true. Yeah. There's no shame once you have kids.
And Brody, question. When people come to see you, and I think this is important to talk about, is it kind of an embarrassed story when they're talking to you? Are they open about it? Because I think it's important. People are embarrassed to be seen for these kinds of things.
Yeah, I think honestly for the ones, they're quite scared, right? And when I think of the ones with internal hemorrhoids and all of a sudden there's blood in the bowl, they're very afraid that it might be something like cancer, right? That would be up there. There's worry, like have they bled too much? They're feeling dizzy, lightheaded. Are they going to need surgery? And then for those that have the external hemorrhoids, they're in so much pain that I think that kind of mitigates a little bit of that, like not wanting to come in to do stuff about it. Sure. There is definitely some that are a bit more,
right. So that kind of acute pain is something we see often with kind of external hemorrhoids that have just acutely thrombosed, that kind of marble. Like, you can't even sit, on your butt because it's so painful, right? So it's very hard to do anything. So I think at that point, they're like, oh, just do something, do anything. I'm all game.
I don't have a choice.
Exactly. But there are other symptoms, like Brody says, the bleeding. I think that's another one that worries a lot of people. Maybe not to a point they'll go to the emergency room, but certainly to a point that they'll talk to their doctors and get referral to, one of us or colorectal surgeons to get it checked out. And again, the bleeding part is very important because we talked about this, and then, often, especially if you have family history of colorectal cancer, or if you're of certain age, over 40, especially nowadays with the increased incidence of colorectal cancer in younger population, something that you definitely should be checked out and receive investigations for. But, quite often, it's because of the internal hemorrhoids, which is a relief to a lot of people, but it's something that, people will have to work on to improve on, because the hemorrhoids can get bigger and can cause, issues down the road. And then there's the lump or the bulge. So as the internal hemorrhoids get bigger, they tend to occupy the space more and more, and then to a point that they prolapse down into, through the anal verge, and then you could either feel and see them at the level of the, anal sphincter or anal verge. So those are kind of the usual symptoms that patients will come with. There are other things like some itching and irritation around that area, which is quite common when you have kind of the anal pathology. It's just the seepage of the mucus coming through, or there could be some mucus discharge, or some of the feces just coming through as well. So those are kind of the symptoms that will prompt patients to come in. So if you're having these symptoms, again, very important for you to be examined. Show your butt not to anyone, but to medical professionals with the right qualifications, not to
ask
not
for
to
a license,
Josh.
please. Yeah.
Please verify the license before you do that. But it's very important because you want to make sure that it's yes. I mean, first, if it's hemorrhoids, they're in effective treatments, and second, to make sure it's not something more sinister like colorectal cancer.
Yeah, and just to really clarify it, who should be seeing the doctor? And I'm guessing the family doctor is probably the front line outside of the kind of emerge visits and then the more serious stuff. So when should you see a doctor?
I think
anytime
any of the
you
symptoms,
have bleeding, anytime you have any of those symptoms, right? And again, I think, James, to your point with like the rising incidence of colorectal cancer, even in younger people, we're not screening till later on that we're seeing a lot of these cases sometimes. Any of those things, I think, is super reasonable to go and to be seen.
Yeah.
I was going to say, maybe quickly, like if they are going to see you, James, or see a doctor in clinic, do you want to talk with me about what's going to happen?
Yeah. So I think, thank you for reminding me, Josh. So I think
you're very welcome, James.
I think it's very important to kind of set the scene for a lot of the listeners who may be suffering in silence, but really afraid what's going to happen to them when they go see a colorectal surgeon or GI doc who does these anal pathology. So, it's going to start off with, having conversations about your history. And then, the part that we're worried about the most is the physical examination, right? So the physical examination will involve perianal examination, so examining your anus. And I think there's a lot of shame and, embarrassment or fear about that. Maybe, it might be that some patients will feel that they're being judged. But really, for a lot of us, the physicians, we do these perianal examinations a lot, like thousands and thousands of times, that, really it's not something that we will take a mental note of or think about a lot. We're just really interested to understand whether there's any perianal pathology that we could treat. So don't feel like, the doctors are judging, how your butt looks. We don't care. We only care whether there's a pathology or not. So
there's no way to count the number of butts seen. I feel like by the end of even the end of our medical career, we have seen more butts than there are trees and forests. Like there is.
Yeah, I'm sure for you, Brody, as well. I'm sure you do a lot of digital rectal examination.
It would be very abnormal for me to go, a single emerge shift without seeing multiple butts in that day. Yeah. To your point.
And it's really it's interesting because we know you as the patient this is the one time this is happening to you, so it's a huge deal. And us as doctors, like when we become patients, we're all nervous about this stuff too, even though we see it every day. So it's completely normal to be going in like that.
Yeah, I certainly understand, where this fear and embarrassment comes from. Like, but I think the benefit of being seen trumps, that little bit of embarrassment that you may have. And, just to set the scene about the examination table, sometimes it'll be just regular exam table and they'll ask you to do kind of, lay on your side and kind of tuck your legs in to be able to expose the anus better. But they're also, especially in colorectal clinics, there are these specialized chairs where you're kind of sitting on your knees and then kind of draped, your body forward so that it's a little bit easier for, more ergonomic for you to, show the butt. Or it could be that, they have the stirrups. So you're going to be on your back and then your legs on the stirrups, like, if you will, in gynecology. So those are kind of the three positions in which you may be examined.
Listeners, you can't see this, but James is giving us demonstrations on the camera of what the positions are, and it's quite entertaining.
There are unnamed yoga poses that he just created.
That's right.
Yeah, really. The hemorrhoidal yoga pose.
So it usually starts with the visual examination, inspection of the anus, and then oftentimes the doctors will talk to you because we know that you're anxious. And go through what the steps are. And oftentimes it does involve a finger in the butt examination, the digital rectal examination. And oftentimes it involves anoscope. So these are small kind of speculum or small kind of scope that goes into that anal canal with the light so that it allows us to examine the mucosa or the lining of the anal canal, so that we could see whether there are any internal hemorrhoids, and if they are, whether they're bleeding and what size. And also, it just helps us to visualize the pathology really well. So, and when we do that, lots of lubricant to, minimize trauma. And it's going to be a little cold because oftentimes it's either plastic or metal instruments. So that's something that, you may expect. And really, it should take not more than 10 minutes. So, I want to kind of allay the fear around being seen for this.
James, when you're putting the anoscope in, how often is there a fart that sneaks out? Again, just to normalize it.
Yeah.
Again,
absolutely.
if these are the cushions that keep it all in, you're
Yeah.
now opening the cushions.
Well, I mean, so that's very interesting because it's no longer kind of fart because there's no like sphincter. It's all spread out, right? So there isn't the unique, sound that comes through tight anal sphincter. It's kind of all spread out. So it's more of just the gas that just comes out. So if you're
that, it's truly passing wind.
That's
there you go. I was going to say temporary fan.
So, I would say if you're providers and maybe you're more of a junior trainees, I don't recommend putting your entire face too close, and recommend wearing, eye shields, mask. So don't do it without much protection, and don't put your eye just straight in there.
Yeah.
Brody, I think that was the best question of the podcast.
Genuinely curious.
I'm really proud of you for doing that.
To me,
that
I'm just
was
like, I'm picturing this all, and I'm like, I don't see how you don't. I don't know how you don't fart.
Yep.
Like, at that point, I don't know.
except
you got no
like,
mechanisms to keep it in
except
anymore.
it
You
just
can't be
like
polite.
passively just passes the gas.
Yeah. It just becomes with the room. It just
Yeah. No, it's completely normal. Completely normal. Yeah. So that's what's to be expected when you're being seen. And then let's say you have, let's say, internal hemorrhoids, especially the
Let's say
grade 1 to 3, right?
Yeah.
The more of the milder ones. Then, the real cornerstone of treatment is lifestyle treatment. And it's really about addressing the root causes, which tend to be in North America, that we just don't eat enough dietary fiber. Sometimes we don't drink enough water, and we're spending too much time on the toilet. These are all kind of contemporary problems that we have. So let's break down all of them. So fiber. Studies have shown that less than 5% of Americans consume adequate amount of fiber, and adequate amount of fiber could range from 25 grams to 30 grams a day, depending on your size and everything. Oftentimes they come from leafy vegetables, fruits, the vegetables with stems, the cellulose, and those things. It's very hard to consume all of that from just diet only, especially in our North American diet. So I think for most of us, it's important to supplement with some sort of supplemental fibers. So those include psyllium husk or some brand names like Metamucils and things like that.
And I think just because I don't, when we say 25 grams of fiber, and I don't know this either, I have to look it up, like things like half an avocado come up, or 1 tablespoon of chia seeds, or 2 tablespoons of nuts, or things like that. So there's, you can just look it up, obviously. So it's not a ton, it's doable.
I think the easiest way to consume that amount of fiber, this is actually, I'm going to give a credit to Sammy Chatty at the Toronto General Hospital who taught me this, is the brand cereal, the brand buds. Those are the purple box. They look like dog food, taste like crap.
She's like dog food.
Sell it, James. Sell it, buddy.
Those contain the most amount of dietary fiber. And when you look at the nutritional content, I think half a cup will give you something like 20 grams of fiber. But when you're doing that, and I recommend that you do that if you're not getting enough fiber and if you're constipated. But when you do that, don't start at full cup or half a cup. Start at a quarter cup and do it for a week, and then go to the half a cup and then the three quarters. Because if you start at high level, you're going to get really bloated because your GI system is not used to having this much of fiber. So you'll feel very much bloated. So your body needs some time to adjust to this amount of fiber. So just kind of go incremental level and just take the fiber that way.
So I'm hearing if I didn't do well in my fiber for the last 4 days, I should not try to make it all up in one day.
No, I think you'd be very much bloated.
Poop.
Yeah, you'd be very much bloated.
Got it.
So
I made some big mistakes, guys.
Yeah, we definitely don't recommend it, and definitely don't recommend following Josh after he poops.
It was also, I think, our first official commercial and ad, not sponsored, but it was also terrible. Fiber cereal. Looks gross, tastes gross, but it'll help you poop. It's like the Buckley's of
That's right.
But
it tastes awful, but it helps.
It helps. I love it.
The other part is hydration. So, if you're really dry, then your GI tract will reabsorb more of the water from the diet. So it's important for you to be well hydrated. Recommend 8 glasses of water, as Brody's drinking water right now, to keep his poop soft. And I think the most important, and this is really a contemporary health problem, is just the good bowel habits. So what I mean by that is, don't spend more than 5 minutes on the toilet to go. you should try not to strain that much. That's hard if you have really hard stool. That's hard if you don't have enough fiber or water. But it's really important that you don't watch like Netflix on the toilet, finish the whole episode. That'd be really impressive.
Hardest to not go. That is my quiet time. It's like, especially as like a parent, you're like,
you're hiding there.
Half my day I'm doing email.
It's the only solitude we get, James. Don't take this away from us.
Come on, James.
Yeah, I mean, you guys are all adults, so you can make your own decisions. But do you get the happy time versus hemorrhoids? There's always pros and cons.
All right. I'll consider it.
Yeah, so those are the preventative measures, which are really the core important ones. But when you do have hemorrhoids, how do you keep it clean, and how do you help the swelling reduce? There's you could really we call it sitz bath, but so there are specific kind of bucket that allow you to put some water and sit on it. I think if you were pregnant before, you probably received something similar after you deliver a child, like just a little plastic bucket kind of thing. So, but really, you could just do it in your bathroom, like in your bath. Put some water. I don't recommend putting any salt or anything like that. Just regular water, and just sit there, clean a little bit. It's just to help with the swelling going down.
Okay. And then maybe kind of get into the more
Yeah.
significant treatments, the more
Yes.
interventional treatments.
So
things like
for
that?
internal hemorrhoids that are particularly large, like grade 3 or 4, or they're internal hemorrhoids that bleed and they continue to bleed, then there are some office-based procedures that can be done. So if we identify those hemorrhoids, that we could place a rubber band around that hemorrhoids, and over time, that will constrict the blood vessels there, and then it will basically dry up that tissue, and that's an effective way of controlling that hemorrhoidal tissues. And we could do that because it's above that dentate line where we talked about the innervation or nervous system.
Oh, pain.
Isn't specific to sensory, so you don't really feel it. So you shouldn't be feeling pain after this tight rubber band goes around it. It's a quick 5-10 minute procedure that's done in the office setting with the anoscope, and you don't need sedation because there's really no pain that's expected from this.
Do you know what I love about medicine, guys? We have things like robotic surgery and stem cell research and transplants. And then we have rubber bands. Our lives are incredible. It is so funny.
Yeah. We got another version of Operation, like the kids game. And now it's like a whole other use for the rubber band now.
There you go.
Oh, yeah.
Assuming the band, then once the hemorrhoid comes out, you just poop the band out with it? The band doesn't stay latched thereafter. It's just whatever's holding it comes out.
Then it goes away. Yeah. And I don't recommend bringing that back to the doctor that put it in.
That's fair. You don't need to collect it. You don't reuse them.
Yeah.
We tend not to.
And don't use it. Don't use it in the kitchen. Don't reuse.
Yeah.
It's not a hair tie.
It's a very small band, so hopefully. Okay, so that's the band ligation, and then the surgery. So inevitably, if you Google about hemorrhoids, or if you talk to some friends, they've undergone surgical procedures. That's to remove the hemorrhoidal tissue. That is really reserved for grade 4 or hemorrhoids that are so recurrent that keep coming back, or if there are multiple of them and it's very hard to manage. So those will be done under general anesthesia. The idea is to remove that hemorrhoidal tissue. There are many ways of doing this, so I'm not going to get into the weeds of this, but it's either by removing them with cautery or with stapler. But these are effective way of treating these, but they're super painful. As my mentor and former colleague Marcus Bernstein at St. Mike's used to say this is the most painful surgery that patients could have. And he does a lot of this surgery. So I trust him. So this is why we don't recommend hemorrhoidal surgery for small hemorrhoids. We don't recommend hemorrhoidal surgery for the first time small, especially first time small hemorrhoids. If you do have these small hemorrhoids and if the surgeon recommends surgery on that, I would get a second opinion. It's extremely painful. It lasts, the pain, your life will be miserable for like 4 weeks because of the pain.
Like the recovery, not the surgery itself, just
not not the surgery itself, but the recovery. But it's certainly, if you're recommended to have it and you have really big hemorrhoids, recurrent, very problematic hemorrhoids, it's certainly effective treatment, for those who have indications for them.
And I don't think we've talked about it yet. What about external hemorrhoids? What do we do for treatments? I'm guessing it's a bit more streamlined, a bit less.
Yeah, James, I don't know if those get sent to you as much, or like those are again what I see the most in the Emerge. And for me, it's a matter for whether they're like thrombosed or not. So again, are they hard, firm? Are they purple? Like has the blood inside?
Is there blood clot inside
clotted,
or not?
Yeah. And if it is, then the treatment for that is we would do like to lance it. So to cut it, get the blood out, and then usually it'll shrink over time. That's done with some local anesthetic. Again, it can be painful, but done in the emergency department or the clinic type setting. And usually after that, then once that blood clot is out, the tissue is still enlarged, but over the next couple of weeks will kind of shrivel up, become like a bit of a skin tag sort of thing in a few weeks, few months time. James, I don't know if that's kind of what you see, or if you get a lot of those referred to practice as well.
Yeah, so excision for these external hemorrhoids are often performed at a really acute level. So if these occur acutely thrombosed, that's a window of opportunity there. If it's subchronic or it's been there for a number of weeks, the idea is that it will get better on its own. So we won't necessarily do excisional surgery for those ones at that point.
And then maybe just to finish on that sense, sometimes people come in and their external hemorrhoid is not thrombosed yet, and unfortunately, then acutely, I actually don't have much to offer other than the dietary things and some pain medication to try to get them through it. It's kind of giving it a few more days until it does become thrombosed, and then you can kind of do that excision at that point in time.
And a good old therapeutic communication. You reassure them. You tell them what's going to happen. You give them the
next few days are going to suck. I'm really sorry.
We got you.
Do your best to try to have a poo.
Yeah. Sits bad. Really. Bowel regimen.
Don't bring your phone into the washroom.
Yeah. Don't watch Netflix on the toilet.
And all of the fiber cereal. Just take the whole box. Forget about James's advice. Go full bloat. Just full bloat. All right, James, I want to bring us to my new favorite segment of this podcast as of last episode, if anyone listened to it, which is our myth busting segment. So
let's do it.
James, any myths associated with hemorrhoids? Let's address them. Let's get to it.
Yeah, so the ones that I hear a lot from patients is like, sitting on the cold surfaces, like, should I always warm up my seats? Like, especially, if you live in Northwest or Northeast, when it's a little cooler in the winter, do they cause hemorrhoids? What do you guys think?
No, I think they would help. Wouldn't it help feel better? A little ice, a little,
it's false. Yeah, they don't cause hemorrhoids. And hemorrhoids, as we talked about, really the root causes are, constipation, straining, repeated trauma into those hemorrhoidal tissues. And, Josh, to your point, maybe it will help reduce the swelling a little bit. Possible. I don't know if there's any randomized controlled trials on them, but
no, we can probably leave it with it won't hurt.
It won't hurt.
Maybe it'll help. Yeah,
but it won't cause the hemorrhoids. Busted. Myth busted. Nice. Anything else that you guys know?
What about spicy food? Like, is there any correlation with heat, pepper level? Oh my God, what's the term for the hot sauce? And how they're measured? Scoville units.
Scoville unit.
And,
oh, nice. Yeah.
And hemorrhoid size or duration or
so not directly related in terms of consumption of spicy food and, development of hemorrhoids per se. But if you do develop diarrhea or loose bowel movements or, ring of fire, if you will, after eating spicy food,
It had to come up.
that would inevitably cause repeated trauma to your anus and to the hemorrhoidal tissues. So that could, in turn, develop engorgement of hemorrhoidal tissues. So there may be some correlation, but not directly.
Gotcha. And definitely not recommended while you actively have hemorrhoids.
Yeah, and you are expected to have diarrhea after eating spicy food. Yeah, I definitely do not recommend it.
Yeah. All right. The one that I think everyone hears and talks about is only people of advanced age get hemorrhoids, and we won't go into a number here. But
Yeah,
as a general rule, is that true?
it's not true, but hemorrhoids could occur across any age. But it's certainly true that, increasing age means there's more exposure for trauma in the anus. We're talking about, if you're constipated, hard stools and things like that. And constipation prevalence increases with age as well. So there are all these associations that are age related that are likely to be risk factors for you to develop hemorrhoids. So false, but there's some temporal associations or age associations related to development of hemorrhoids.
There's probably more prevalence as we
That's
get
right.
older.
Yes.
It can happen at any age,
Yeah.
but it's there.
Okay. And lastly, James, I think maybe touched on it a little bit, but do they come back? Like, do hemorrhoids always come back?
Yeah.
Is it something like you have it once, it's going to be a lifelong thing? Like, what does that look like?
Yeah, so there's tendency for them to reoccur in your lifetime, and it's mostly because the root causes are not addressed. So, what led you to have hemorrhoids the first time, which were constipation, straining, and let's say you adopted lifestyle modifications to help them reduce, but then you have another child and you're looking for more solitude, and you're locking yourself in the toilet and watching Netflix. Hemorrhoids are gonna come back. I'm sorry.
All right.
So
pick a good show.
Yeah.
Don't regret it.
Yeah,
so
make it
there's
worth
always trade off, right? So if the root causes are well managed, then the treatments are very effective. So really, the basic pillar of the treatment is a lifestyle modification. It's hard to, as we talked about it, lifestyle modification is hard to stick by them and adhere to them. So if there are deviations, these things could come back.
Awesome. Good myth busting segment, buddy.
Yeah. Bust it.
Yeah. Busted, confirmed, a bit of both.
Uh-huh.
All right. Should we wrap it up for listeners? A couple of take homes.
Let's do it.
All right. I'm going to go first. I feel like I haven't gone first in a while. So I'm
All
going to
right.
dib it.
Oh, good one.
All right.
Yeah.
Yeah. Okay. So my take home is don't beat up your butt. Like, lessen your anal trauma. Be kind to your butt. Talk to it nicely. Be gentle with it. Have your fiber. Netflix appropriately. Don't waste it on a reality TV show.
Yeah. I think that's a really good one. And I'm going to, bring up Marcus Bernstein again, who taught us to treat anus like cornea.
Oh,
Oh, I like
Yeah.
that.
Don't scratch it so
Yeah.
much. Don't rub it so much.
yeah.
Just
Yeah.
Yeah.
very
Careful
precious.
about what goes in there.
That's right. You only have one butthole to live with for the rest of your life.
Wow.
And you have two
eyes.
corneas, so you should be even.
Well, there you go.
Oh my gosh.
Maybe it's even
Yeah.
more important.
Okay. I'm going second because, James, it's your podcast, so you get to finish us off. So I'm just going to stress the lifestyle things: fiber, water, and then exercise and movement. And honestly, the 25 grams of fiber a day, it's not so hard. And I'm saying that personally because I suck at it. And now I'm going to actually just keep a little spoonful of nuts or something at the side. And I'll take that and I'm good for the day.
Something about a spoonful of nuts that,
It does sound... Yeah. No, I'm going to stick with that. I'm going to own
All
it.
right. Fair enough. Okay, so for the internal hemorrhoids that are larger, that are very bleedy, and that recur frequently, that become big issues, there are effective office-based treatments like band ligations, or for some select patients, surgery for them are very effective but quite painful recovery. So talk to colorectal surgeons who do this every day. Get your butt seen if you're having the symptoms of bleeding, bulge, pain. Very important for your butts to be seen and examined.
They're in the dark most of the day. Let them come to the light, buds.
Come to the light. We have a lot of good slogans on this one. We can make some T-shirts, some public service announcements.
Get your butt seen.
Catchy.
Get your butt
Yeah.
seen. Yeah, that's a
Let your
great
butt into the
public
light.
service slogan. Just saying.
And also for colorectal surgery, colorectal cancer screening as well.
Yeah, absolutely.
Yes. Yeah. Well, James, thank you. This was
Oh, Josh?
I would say I'm going to do mine again, so spoonful of nuts is not in this.
too late.
It's now that we say it over and over, I'm like, we can't do this.
How long have you been I've been percolating there for the last 2 minutes. He's like, I must get rid of the spoonful of nuts. Now you've just doubled down on it, man.
I will rarely take something out, but I'm like, what's not?
I'm gonna make a 3-minute clip of you just saying a spoonful of nuts. A spoonful of nuts.
Spoonful of nuts. Spoonful of
Yeah,
nuts.
we'll send it to you.
Some auto tuning.
That's Danny Go's second song collaborating with us coming up after Happy Hemorrhoids. Spoonful of nuts. All right.
Love it.
Kids music venture after all, guys. Yeah.
That's
Okay.
amazing.
So I'll just say it. If you can edit this back, I'll say I'm just gonna have a spoonful of trail mix around me at all times.
James,
Amazing.
thank you so much for taking us on this journey. I think really important. Again, a third of people have them. It's great. Super common. And
Super underrated.
Yeah.
Super underrated.
Yeah.
I learned a ton from you, James and Brody. Thank you guys.
Yeah, this was
of course.
great. Yeah. Take care, guys.